many homes around the world due to the COVID-19 pandemic. In my demonstration today, I'm going to be providing information on cannulation of a vein, a common practice in today's medical field. From the purpose of cannulation to the steps of the actual cannulation of a vein, I am a practicing paramedic in rural Oklahoma and have been in the medical field for 13 years. First of all, we're going to look at possible reasons for venous cannulation. Second of all, we're going to be reviewing the equipment used for the procedure. And then finally, we will discuss the steps involved in cannulation and see a live demonstration of the procedure being performed. First, let's look at possible purposes for cannulation of a vein. It can be used in sampling of blood as well as medication administration, as well as administration of blood products. Now that we have reviewed reasons for venous cannulation, we're going to go over some of the equipment that can be used. Basic supplies needed are saline lock, flushes, IV catheters. We have sizes from 24 to 14. Some alcohol preps, tourniquet, gloves, 2x2 gauze. Finally, we're going to go through a step-by-step process and a demonstration of an IV being started. My friend and co-worker Shayna is going to be starting the IV on our participants. Mason, come up here. So first of all, Shayna's going to be tying a tourniquet around his arm. After she ties the tourniquet, she's going to find a suitable vein just by palpation, which is just feeling. We normally apply the tourniquet a few inches above the site that we're going to be inserting a catheter. Once she finds a vein, we're going to disinfect the area with an alcohol pad. I'll help you with that. This is a 20 gauge IV catheter. We will also make sure that once the catheter is open and the cap is removed, that we are not touching this with any other surfaces, just to keep it sanitary. So once she has inserted the IV catheter, blood will flash back into the plastic. Lots of pressure. Then we will apply the saline lock and flush the IV site to make sure that it is a patent and good IV site.
You might taste some saline.
Then we will use some tape, or in our case here, a Venegar, to secure the IV. The tourniquet was removed. Normally this would be placed in a sharps container to make sure that everything is kept clean and sanitary. So just a quick review of what we've discussed and seen today. We initially discussed possible purposes for an IV catheterization. Then we went over the equipment that is used, and then we actually went step by step through the process and a demonstration. Make sure that any IV catheterization should be done in a sterile medical environment and by medical